finally, after about 4 or 5 years of being on like, Tramadol, Oxycontin, Hydrocodone, which doesn't do anything for me except put me to sleep. Oxycontin works okay, but I've always found Hydrocodone to be fairly worthless. I don't know, I suppose it had its time when it worked, but. Lyrica, lots of Lyrica. I'm not sure. I
Everybody
suppose.
says that.
Yeah,
I'm not sure.
maybe a little bit, I'm not
But
sure.
then, but you know, then you stop it and it's like, oh, I'm worse.
But
Yeah.
then that's placebo right there.
I guess it does quiet down, nerve pain. I've done the TENS units. Lots of physical therapy. And I'd have to say, the McKenzie physical therapy I've got respect for.
All right.
Most of the other I don't.
Who's Mackenzie?
Anna Nash.
Uh-huh.
But Mackenzie was the one who developed the method.
He's a Aussie,
New Zealand.
back specialist.
Yeah. And it's interesting because I've done that here and I've also done it over in Seattle. And so it's pretty cool. Hey. How are you?
Bella!
Anna's from Sweden.
Yeah.
Yeah. But done all of that, finally went in for surgery to go ahead and clean up the disc and
Uh-huh.
also open up.
You had that done?
Yeah.
Okay.
Also open up vertebrae through laminectomy and discectomy.
And that worked?
For a while. But, you just kind of keep on going up the spine. And at this point, I'm at the point now where I frankly would love to have some surgery.
If it would do you any good?
I don't know, because nothing else is doing me any good.
Yeah.
I missed, a month and a half of work just recently, which as a teacher creates real problems.
Yeah.
Because your kids aren't learning, and you go back and, it's a nightmare to go back.
Yeah.
Did go through a series of injections up in Great Falls over the last couple of months. Thought that was working for the first 2 or 3 weeks. I don't have the pain where you feel like cutting parts off.
That's bad pain.
But it does kind of feel like, somebody's been kicking you in the back.
Yeah.
And so that's still there. So,
Yeah.
then you start climbing up the stair step up the drugs again. And at what point do you sit there in front of a bunch of 10-year-olds going, Jesus, why am I here?
Yeah.
More drugs.
Yeah, because you're thinking, I'm wasted.
I can't
I'm in
witness.
front of these kids.
Yeah. And you gotta be present.
Well,
Yeah.
10 years old, they probably had enough to sell you.
Not quite. Something about 12-year-olds having access to pills in town. So that's such a great topic. How do you be with 10? That's third grade, fourth grade. So how do you be with fourth graders? Thank God they're not seventh graders. But how do you be with fourth graders and be on your game? Because if you're in pain,
Yeah.
you can't be present.
Yeah.
And if you're too altered, you're not present. And if last time we talked, was the third factor to this is if you're too pissed off, you can't be present. And because it's just the rage of having this go on for so long is, you're surfing something, but you're not surfing the exhilarating wave. You're surfing a wave of something else. In retrospect, you can kind of see that that you've gained some power here through everything that you've been through, and you have kind of surfed the wave of this back thing that's happened, the chain reaction of it. You're in chain reaction accident. It's had a chain reaction
Yeah.
through 40 years.
More.
Yeah. Okay. So it's like been a long time. It's like your cross to bear. Like,
And, I mean, for part of that, well, I guess I've always self-medicated.
yeah, well, good.
I was gonna say for part of that, it wasn't bad, but I've self-medicated.
Well, that's what human beings do. We're all about self-medication. And anybody who thinks we're not is a fool or a
Yeah.
liar. Because we've been self-medicating since we were Bella's age. I think
She's
we,
1 year.
Nobody
how old is she now?
wants
She's
that. 7 months.
7 months. So we come down the birth canal screaming for this world, sucking in that first air, and the first thing that comes out is wham. And we are equipped to dial 1-800-WHAM. We know how to complain.
Call the ambulance.
We know how to complain. We don't necessarily know how to problem solve or let go of things or not be attached, or I'm trying to avoid Buddhist language so Scott doesn't come
No,
here and
no,
kick
I
the
love
shit
it
out
all.
of
That one I can't do.
me. But it's like yeah, particularly, I mean, Buddhism forced on someone.
No, I voluntarily went into the Kabat-Zinn's whole thing.
The whole mindful thing.
Yeah, and this was back in the 90s. So
Yeah. Pioneer.
but this one has come up recently, and pain is inevitable, suffering is optional. When you're in a lot of pain, you really don't want to hear that.
No.